at a dime, sometimes at a dime. We're doing this through subscription to a high-value, low-cost telehealth communication bundle that connects people and populations, individuals and institutions, in this case, first responders and volunteers, to timely, reliable capacity beyond the point of emergency. That's a snapshot of our call center. Our model is based on a zero hardware remote connect to our medical doctors for emergency health support, so you do not need any hardware to access us. We currently have 4 different packages: a product, a clinic, a training school, a broadcast station, and a local access network. Next, please. Next, please. From your phone, again, though our goal is to talk, triage, treat, train, track, and transfer, while we communicate, care, and cure. From your phone, we can tell you, inform, and advise. We can tell you, investigate and prescribe. We can tell you, educate and counsel. We can tell you, feedback and follow up. We can tell you, monitor and evaluate. We can tell you, collect and report outcomes from our phones. Next slide, please. Whatever your agenda is, we'll give you some choices to pick from. So you can call and demand to speak to by name to the doctor you have spoken to before, you have a relationship on the phone with. You can seek to be anonymous. This means that while we're entering your data on your patient's medical record form, you can, when we ask you for your name, you can say you choose not to give it. Because indeed, there's no diagnosis that is hinged on a name. You can choose to be spoken to in English, Pidgin, or any local dialect. You can choose to have that consultation on text, audio, or video. And you can choose the gender of the doctor you want to speak with. So for instance, you're a woman going through woman-centric problems, and a man picks up the phone, you can decide to say, you'd rather speak to a female doctor. Next slide, please. So yes, there's something called a TCPR. It's a telephone CPR, especially for those people who do not know how to do a CPR. This provides you a choice. So if someone slumps by your side, you can quickly get a doctor on the phone, and in a couple of minutes, you can begin to perform CPR on a person's life. We have about 5 different plans. We have the individual, family, organizational, institution, and the local access network. Next slide, please. So this is just a brief table showing us the different maneuvers within the plans and the products. Next slide, please. Because having an advantage is the only way to compete. Our results are our singular conviction. We have a presence in 7 states across 4 zones. We have a partnership with 5 private organizations. We have sent a little less than 500,000 broadcasts. And we currently are taking 1.4 million calls. Next slide, please. Thank you. Next slide, please. We're a first mover in the industry. We're founded in 2016. We're one of the organizations that provides you both an individual and institutional model. Our model is very easy to use. It's just pick up your phone. You don't have to build an app, buy an app, and then enter your name and no network. We also have a lot of avant-garde strategies that we use to drive our subscription base. For example, we have a care community where you can come in. That's discussion from another day. So this is what our opinion leaders are saying. Next slide, please. We're a team of 3 young, 2 men and 1 lady, that's me. I'm the health partner. We have a telco partner and an IT partner. So again, it is This slide is a very important slide. Whether as a healthcare consumer, provider, distributor, manufacturer. When it comes to healthcare, the vision is virtual, the mission is mobile, and the destination is digital. That's the only thing we should have in our head about healthcare. Because our goal is to deliver impeccable service at the level of excellence, we continually review and rate our models, we enhance and expand our options, we generate and grow our subscribers at a substantial rate. So our Dial-a-Doc Direct telephone doctor services, anywhere, anytime, we try to put your doctor right in your hands. Thank you. That was a joke, please ask me.